depleted, and sometimes they will need not just pain management, they will need oxygen therapy, they will need blood transfusion to restore them back. And when persons have sickle cell crisis, the pain can be excruciating. Some patients will describe the pain. We said the highest level of pain is 10. Some of them will tell you it's more than that because of their feelings and the way they feel. We also have the HBsC disease, which is another type of sickle cell, and it also affects the gene. In the hospital, they will say that is the hemoglobin C that is affected, and it's the sickle cell. The cell is this type that we call the sickle cell HBsS. It's less complicated than the HBsC. The HBsC is less complicated than the HBsS. And we also have the HBs beta thalassemia. And this one also, like I said, there are branches. This one also has sub-branches. So it depends on the mutation of the gene. We have the trait, the sickle cell trait, which is the HBAS. The HBAS patient or person that have this sometimes live normal life like you and me. They do not manifest symptoms in most cases. They just live their normal life unless something drastically happens and they are tested. So how do we know that someone has sickle cell? Somebody asked the question yesterday or the other day that what if I have a baby and they have sickle cell and they manifest no symptoms? We do have patients that have the HBs beta thalassemia up to age 18, 19, 20, and they have no symptoms. And one day they can just wake up with pain, depending, and you might end up in the hospital. And most parents of this patient do not know that their babies have sickle cell until they are tested. When they go to the hospital, we do what we call electrophoresis. When they do this will identify the type of sickle cell that the patient has. And that's how we are able to give treatment to them. If we bring it home, when we come to church, I know that we love to pray. It's very important to pray because God do heal diseases and sicknesses. Yesterday, we also spoke about how our spiritual leader should guide us. When person have sickle cell, AS, I said the traits do not manifest symptoms. Often when we were young, in my time, when you have AS and you are a boy or a girl and you are dating someone with the same ALs, your family member will quickly tell you don't go there because you might have baby with sickle cell, full-blown sickle cell. So we discourage people not to do that, but I'm telling us now that with knowledge, with science, it's not a crime. If two young men or a woman and a man do have AS and they make a choice after prayer with their spiritual leader to get married, one of the things that is important is that our leaders also have to get information.